So there are some cancers that are highly associated with alcohol use, like esophageal cancer. Esophageal cancer is really common, much more common in people who drink every day and drink relatively heavily. Oral cancers are also relatively common in people who drink and smoke. And in women, breast cancer is increased in drinkers. Having said that, they are not the primary driver. Alcohol is not the primary driver of any of these cancers. Okay, so it's not a one-to-one. It's not like, and nor is there a clear dose response function. So that again, you can have very heavy drinkers who never develop breast cancer and relatively modest drinkers who do, right? So it's a risk factor. What I would say is that if you have a strong family history of breast cancer, right, I would get your her receptors, your BRCA, BRCA2 receptors measured, and see a specialist about that. And if you're drinking heavily, they would probably recommend that you decrease or stop your drinking. Okay. If you have a strong family history of esophageal cancer or a family history of certain kinds of other GI cancers, like hepatobiliary cancer, maybe you want to watch your alcohol consumption too, and get frequently tested for it. If you smoke and drink, oral cancers are a big risk, right? And quit that smoking. Get a specialist to help you get off of those cigarettes. Vaping doesn't necessarily seem to have that risk. It's the combustion products and that from cigarette smoking that can give all the risk, the carcinogens, and therefore some of the chewing tobaccos can also give people risks if they're drinkers for both oral cancer. So alcohol increases your risk, but it's not like an absolute determinant. It's not like smoking and lung cancer. Okay. Not like smoking and lung cancer, but it is a risk multiplier.
For expert support on medication-assisted treatment for alcohol use disorder, visit riahealth.com.